Good afternoon. My name is Charity Love, and I am the Clinical ICU Educator here at Mount Sinai Medical Center. Today, we're going to briefly go over what items you can expect to find in your bedside code or crash cart. It's very important to know not only what the items are included in the cart, but also know where they're located, so in the event of emergency, you know exactly where to find them in an efficient and timely manner. So first thing to note, the top two light blue drawers are going to be your drawers full of medications. Okay, so remember, medications are going to be in the top two drawers. So first, let's open up the top drawer and see what we can find. When you open up the drawer, it's going to be covered in a plastic covering that needs to be ripped open. Also, there's going to be a sheet that's going to specify what medications are located in that drawer and where they're located in that drawer. So, based on the sheet, we are going to know that we have our sodium bicarb is in the top drawer, top left. You're also going to have your amps of epinephrine. Epinephrine, we know that is something that's very commonly used in most all codes, okay? That's all in the top drawer. Also, you're going to have your atropine. Atropine is in a purple container, as well as your lidocaine. Okay. Also included in this top drawer, you're going to have your 10 cc flushes. That's going to be on your bottom right, as well as in the top upper portion of your right, you're going to have your amiodarone vials. Each one is 150 milligrams and 3 cc. And lastly, your solumedrol or methylprednisone, 2 of these vials. These are all the items that are included in your top drawer. The second drawer is also a medication drawer. Will also contain the list of all the medications that are located in that drawer, as well as specifically where they're located. Based on the list, we know that we have dopamine is going to be in your upper left-hand corner. This is a premix that is already mixed in the bag. It is 400 milligrams in 250 cc's. We're also going to have your D50, your dextrose, is located in the second drawer. We have a pre-mixed bag of magnesium sulfate, 2 grams total in 50 milliliters, and a pre-mixed bag of amiodarone. If you need to hang an amiodarone drip, say hypothetically after giving your amiodarone bolus. This also contains the tubing that you would also need to hang that amiodarone drip. As we move forward, we have our flumazenil. We have 4 vials of 0.5 milligrams per 5 cc's. We have our metoprolol. We have 3 vials of metoprolol. We have our furosemide, also known as Lasix. And we have 5 vials of naloxone or Narcan is also included here. Very importantly, in this drawer, we are going to see 2 vials of our norepinephrine. I know there's been some questions where these are located. Each vial contains 4 milligrams in 4 cc's. Norepinephrine is also known as our Levofed. This tends to be our primary vasopressor that we go to in the event of an emergency situation. In the middle of the second drawer, you're going to have your calcium chloride injections in the yellow box, as well as 5 vials of adenosine, okay, in case the patient might be an SVT. Next to the adenosine, we have our phenylephrine, 10 milligrams per 1 cc, or also known as neosynephrine, another vasopressor. And at the front right-hand corner, we're going to have our individual vials of epinephrine, 1 milligram in 1 cc. Okay. This drawer will also contain the actual needle tops to the syringes as well, individually packed. So that is our second drawer of medication. The third drawer, which is now we're moving into the non-medication for the most part. Third drawer, you're going to have your IV tubing. tubings are going to be in here. You're also on the left-hand side. This is going to be your IV go-to area. So if you need to place a new IV, we're going to have your different gauged IV catheter needles, an IV starter kit. You're going to have your vacutainers if you need to draw blood, as well as your actual vacutainer collection tubes. So if you need to draw blood during a code, these are already ready for you in the third drawer, left-hand side. Also, you'll have your secondary connection tubing if you were to place an IV. In the middle area, you have 3 male lure lock adapters. On the right-hand side, you're going to have 1 bag of sodium chloride. As well as in the top portion, you're going to have your 3, 5, and 10 cc syringes. Okay, so everything you need is right here. We have some additional tape, labels if you have to label any medication bags, clippers if by any chance the patient has an extremely hairy chest and you're not getting a good reading on your ECGs. You might need to trim the hair in order to get a better reading. And lastly, you're going to have the lubricating gel in case you need to take any types of Doppler readings. Okay, remember, this is now your third drawer. Your fourth drawer. Your fourth drawer is going to have your electrodes. Remember, we are no longer keeping the electrodes on top. We have electrodes inside the cart in your fourth drawer, as well as a backup defibrillator pads. Okay, so we always have an extra set of those inside the cart already. We have our sterile gloves are also in this drawer. Some additional masks for PPE. Sterile towels for draping, as well as some tegaderms. We also contain in this drawer a 60 cc syringe, some drain sponges, and very importantly, your backup ECG paper in case your life pack runs out. This is in your fourth drawer. The fifth drawer, which is one of the bigger drawers, this is going to contain a lot of your respiratory and suctioning equipment. So you have an entire suction packet, which contains not only your suction canister, but your suction regulator, tubing, as well as individual suction catheters. This is all combined together in one packet. We have our other resuscitation bag kit. This contains your AMBU bag, the non-rebreather mask, as well as the oxygen tree, all together in this kit. In the bottom of this drawer, most importantly, you have your intubation kit. Your intubation tray is going to contain anything that you're going to need for intubation. It's already there in your code card on your fifth drawer. Okay. Lastly, when we're talking about intubation, you also will have your Ballard if the patient ends up getting intubated and they need to set up the Ballard to connect it to the ventilator. We also have ABG kits in here. If we need to draw an ABG, these are here in your fifth drawer. And lastly, we have about 4 of these single-use laryngeal masks. Okay, this is all in your fifth drawer. As we move to the last drawer, this last drawer is going to contain your central line insertion kits. Everything that you need for insertion is included in these kits. You are given 2 kits in the bottom drawer. Along with the kits, we also have 2 sets of surgical gowns, as well as additional exam gloves and 2 NG tubes, if an NG tube needs to be replaced. That is everything in the last drawer. So, just a quick recap. So your top 2 drawers are going to be strictly your medications for the most part. As you move down, we're going to see your additional electrodes, your additional defibrillators, your suction, intubation, IV bags for any type of fluids. And just a reminder as well, you have backup IV bags in case you need to mix any specific medications. You're going to have your D5 250 down in the bottom drawer, as well as D5 100 cc's, as well as backup bags of normal saline liter bags down in your bottom drawer. It's important to familiarize yourself with all the different items that are located in these crash code carts. Most importantly, we always make sure that we check these code cards for expiration. There should be a sign on the top letting you know when these medications expire. Always on the side of your code cart, we need to double check when you're checking those life packs that you should be checking these life packs beginning of the shift, every shift, to ensure that they're working properly. We also want to check the oxygen tank. Make sure the oxygen tank is full, meaning it's in the green. That we have the backboard should be located on the back of your code cart, because if a patient starts to code and we need to do adequate and efficient compressions, we need to make sure we place that backboard beneath them. All right. I hope this was a good experience for you, and I hope you gained a little bit of knowledge to help you in the future as far as being able to locate the different